Hello and welcome to another session of Dr. Barbara Miller's NCLEX review. Today we're going to be talking about critical care devices that is utilized in the critical care nursing. We're going to start with hemodynamic monitoring. So what is hemodynamic monitoring? It's the bedside measurement of every changing pressure of blood through the cardiac, the pulmonary, and systemic vascular via invasive catheters. So what are the benefits of hemodynamic monitoring? It improves patient outcome. It lowers mortality rates. It also have a better quality of life after critical care. You do have different types of measurements. You have direct and indirect measurements. For example, for direct, you have your central venous pressure, you have your right ventricular pressure, you have your pulmonary arterial pressure, and for indirect monitoring, you would need to calculate like your cardiac output. How would you calculate your cardiac output? You want to times heart rate times stroke volume, which equals to cardiac output, and cardiac output comes in liters. Okay, other indirect measurement such as cardiac index, left ventricular ejection fraction, and left atrial pressure, and also capillary wedge. So the tools, let's start with intra-arterial catheter. What's the purpose of an intra-arterial catheter? The purpose, it measures the mean arterial pressure correctly. It also draws blood for arterial blood gas. It monitors the arterial pressure. The insertion site is at the radial pulse, the femoral pulse, the dorsalis pedis, brachial artery, and axillary artery. Other hemodynamic monitoring, such as your central venous access. What's the purpose of a central venous access? It's when the peripheral site nor accessible for fluid resuscitation. It also for central venous pressure monitoring. It gives you access for the PAC in monitor blood circulation. So where do they insert the central venous access? Your subclavian vein, your brachial vein, and your jugular vein. Another device is pulmonary arterial artery catheter. What's the purpose of pulmonary catheter pulmonary artery catheters? The purpose is to measure pressure in both sides of the heart, left side and right side, and also pulmonary artery. It measures the cardiac output, blood from mixed venous, and fluid infusion. So what's the nursing intervention for pulmonary artery catheter? You want to help with the transducer at the fourth intercostal space. You want to position at 0 transducer at the bedside. You want to have the patient in a supine or semi-Fowler's position. So where would you locate the site for pulmonary artery catheter? Is the subclavian vein, the jugular vein, the femoral vein, or the brachial. Another device called hemodynamic monitoring is the intra-aortic balloon pump. That's IAPB. And what's the purpose of that? It's support in low cardiac output and blood pressure. It also support patient from post-procedure coronary artery bypass graft. What are some signs of complications? Decreased peripheral pulses, decreased urine output. The balloon may migrate, so balloon migration, increase in temperature, the white blood count, and also decrease in the hematocrit. The insertion site is the femoral artery. Weaning, weaning, W-E-A-N-I-N-G, the hemodynamic stable. So those devices going to show if the patient's heart or lungs are unstable, no chest pain, adequate urine output. So this is the end of some hemodynamic monitoring that you need to know for critical care nursing, and also possible questions may arise on your NCLEX examination. Thank you for watching. Hopefully this short video helpful to your success on the examination. Please like, share, subscribe to the channel to help it grow. Thank you for watching. Bye-bye.